Hello and welcome to an OET Reading Part A guided practice. In this lesson, we're going to do a little recap of the OET Reading Part A. We'll then focus in on guided practice with the how to find part of the questions. So that's when they ask you to find which text contains the following information. You'll get a chance to practice, of course, and we'll also take a look at the answers. So we're only going to be looking at the first part of the OET Reading Part A. My name's Sona and I'm your online OET tutor with Bose Learning. I'm a premium preparation provider of the OET. So let's do a little recap then, first of all. So remember, in Reading Part A, you're going to get 4 related texts. They're all on the same topic and you'll get 20 questions which include which text contains, short answers and gap fills. In this video, we're just going to look at which text contains, so come back and take a look at part 2 of this video, which will focus on the short answers and gap fills. The skills you need for reading part A are expeditious reading, because you're only going to get 15 minutes to answer the questions and then this part gets taken away from you. So what's your strategy then when it comes to which text contains? Well, my advice would be to spend a few minutes of the 15, invest that time in understanding each text. In fact, it's a good idea to make your own quick summary. So text A is about this, B is about this, and so on. Just a couple of words. Then go through the questions and, of course, make sure you try and answer everything, checking that you've got the actual part that you need. So let's have a go then. This is taken from the York Fecal Calprotectin Care Pathway and it's information for GPs by the York Teaching Hospital, which is an NHS trust. So this is real English that you might use in your everyday working lives. And this is exactly what the OET is testing. It's real medical related language. Okay, so here we go with text A. So spend a little bit of time understanding what text A is about. So you're just going to read, it's the shared learning database. There's a new pathway developed by Dr. James Turville. We've got nice guidance here, further research is needed, and the pathway increased the recommended cut-off level and optimize the patient pathway. So this is what it is, and it's been recommended by NICE. So if I were to summarize, I would say this contains information about NICE guidance, which includes research recommendation, why it's been implemented, because the pathway increased the recommended cut-off level and optimized the patient pathway to identify real savings to the health economy. So it's done lots of good things. And then the results of what happened. This has resulted in better patient experience. So basically, we've got a little bit of background, isn't it, about the pathway itself. What about text B? Well, this seems to describe calprotectin. So it's a protein released into the tract, which when it's inflamed. So it's giving us a little bit of background information, not about the pathway, but about what calprotectin is. It tells us when it can be identified. It tells us when it's not present, so in things that it's not present in. Why? Because clinically it's often difficult to distinguish between IBS and IBD. So they've developed this pathway to help clinicians differentiate between the two. So again, to summarize, we talk about what calprotectin is, why it's used, because it's a marker, it helps differentiate, and the fact that it's an effective pathway. Okay, it's not 100% accurate, but it is effective. So A was the background to the pathway, B is the background to calprotectin. Okay, I'm going to show you text C now and give you 30 seconds to skim through it and just try and get a rough idea about what it is. Here we go. Okay, how can you summarize this? Well, this is all about the patients, really. It's getting really to the heart of the patients. We have the kind of patients we can consider the request for a fecal calprotectin test. We have when we can do it and when not to request it. Also, the length of time it will take. Okay, have a go at text D in a similar way, 30 seconds, skim through it and summarise. Okay, so this is really about what to do in these situations. So this is the actual pathway itself, and it's the indications. What do these figures indicate? Okay, so to summarise then, text A is the reasons why the test was developed. B is a background to calprotectin, what it is, why it's used. C is all about the patients, when we can use it, how we can use it, and then the results, what do they indicate, are given to us in text D, along with what we should do. So once you have this short summary, and of course you just need a couple of words and just write A, B, C, D for each one. This is something you can refer to and it will save you time in the test because you're not flipping backwards and forwards, you're just looking at your own notes and then you're turning to that to check. So let's have a look at the questions. We'll do some together and then I'm going to give you a chance to do the rest by yourself. But for each question, 1 to 7, we have to decide which text contains the following information. Of course, we can use any text more than once. So here we have other tests that can be offered after or alongside the fecal calprotectin test. So, other tests, which one do you think it will be found in? Well, it's probably C because it's when, how, which patients, which tests. So we go and check, is it here? Can you see any other tests that can be given at the same time? Here, it's all here. It's which other test can be requested alongside the fecal calprotectin test. And these are the tests here. Okay, number 2, what's your keyword? It's the likelihood in percentage terms of a patient having an IBD. Which one do we think that is in? It's probably indications. Remember, there was lots of numbers, figures there, and then telling us what to do. So let's check the percentage of people of a patient likely to have an IBD. It tells you here. So 12%, 46%, etc. So it's text D. Okay, number 3, the reasons not to order a fecal calprotectin test. Can you remember which one? It was this one, when to order it and when not to. Just double check, when should I not request the test? Here it is. Okay, number 4, do you remember what to do when IBS is suspected? Which one do you think it is? Probably indications, so go and check. Can you find it? Treat as IBS and manage the symptoms locally or refer them on. So it is D. Okay, number 5, the developer of the text. Which one was it? Probably A, so check. Here it is, developed by Dr. James Turville. Okay, number 6, the reason the test was developed. Well, I think that's A. Okay, so the reason the test was developed was as a biomarker. And number 7, when calprotectin is released by the body, when is it released? Here we go. B. It is released when it is inflamed. So it was text B. So that was a very quick look at how you can answer which text contains. I've gone into this in far more detail in my on-demand course, so take a look at the info box below where I put in some links including some discount codes, and come back to the next video when we're going to be looking at the rest of OET Reading Part A using the same texts. Thanks for watching. If you've got any questions, feel free to get in touch. Just pop a little comment in the comments box. And if you like this video, please remember to press that like button and share it with a friend or colleague so you can help me grow this channel. That would be amazing. Thanks very much. Take care. Bye bye.